Hi, good morning, everyone. I'm Dr. Christine Shamala Selvaraj from the Department of Primary Care Medicine, and welcome to the second part of this morning's session. I'd like to start by introducing our speaker, Dr. Jazlan Jamaluddin, and his talk is titled Prescribing Connection, Not Just Care, an Introduction to Social Prescribing. And this is a very exciting topic, as social connectivity is a very important but often neglected pillar of lifestyle medicine. And it's particularly important and relevant to all of us as healthcare practitioners to see how we can help to encourage and cultivate this amongst our patients. So a little bit of introduction about Dr. Jazlan. He is a lecturer and family medicine specialist also in the Department of Primary Care Medicine. Although he's very early in his career, he has very impressive CV, especially with respect to research, a very nice long list of publications already. He is an editor of the Malaysian Family Physician Journal. And his research interests include non-communicable diseases, self-management, as well as social prescribing. And to members of the audience, please feel free to type in any questions you may have in the Q&A box, and we will get to that at the end of the talk. So without any further ado, Dr. Jazlan, I hand over the platform to you.
Thank you very much, Dr. Christine. Assalamualaikum and a very good morning, everyone. Thank you for staying back with us today. Today I'll be continuing on the theme of patient care from Dr. Hafiz just now. So specifically talking about prescribing connection, not just care. So just an introduction to social prescribing. So let me just start with a quick question. Perhaps anyone who agrees or perhaps want to say yes can put in yes in your chat. So have you ever had a patient with something that was really not medical? For example, maybe they were lonely after losing a spouse. Maybe they were stressed from work. Maybe they were struggling with financial worry that were affecting their diet as well. So these are the moments that perhaps you can clearly see the real issue, but the prescription pad that you have on your table perhaps had nothing for it. Well, what if there is? So what if there is a way to address not only the individual risk factor, but also the biopsychosocial factors, the one that actually contribute up to half of the person's health outcome? That is exactly what we are going to talk about today, social prescribing, and how it can help us move from simply treating illness to truly building wellness. Now, social prescribing sometimes is also called community referrals or non-traditional providers. So in short, it is about building bridges from the clinic to the community. So instead of, for example, you are saying, take this tablet, you could also say that I'm referring you to a walking group or perhaps a community garden or financial advice services. So that is perhaps the difference between prescribing a hypertension or a blood pressure pill and prescribing a reason for patients to get out of the bed in the morning. Now, here is how the social prescribing works. So in the classical model, the primary care providers usually starts by assessing the patient's need for social prescribing. Then they would refer this patient to what we call as the link worker. And the link worker usually plays a very big role in this case. They would sit down with the patients for a so-called what matter to me conversation and then they co-create a personalized wellness plan and then connect them to the right community-based services. They could also offer some ongoing support using the behavior change technique. They will also refer the patients to community based and also voluntary services. This could mean individual activity or group session. And of course, this progress must be reported back to the ring worker and also the primary care provider as well. So there's also another model which we call as direct referral model, where the healthcare provider actually skips the link worker and refer directly to the community or voluntary organization. Then the primary care provider would actually monitor the progress themselves. So either way, the goal is the same. We want to connect people to the kind of help that perhaps medicine alone cannot give. So actually, social prescribing has an interesting history. It began in United Kingdom in the 1990s, where the biopsychosocial model was encouraged with a broader view of health. So in the 2010s, the focus on prevention grew stronger with more emphasis on the voluntary and also community sectors. In 2013, the Social Prescribing Network was launched in the United Kingdom, and by 2019, the NHS has embedded social prescribing into their long-term plan as part of the personalized care. In 2020, the UK Department of Health has actually allocated about £5 million to set up a National Academy of Social Prescribing, which is now an independent charity. Now, when we talk about prescribing, the options are actually endless. So you can prescribe traditional supports, things like financial support, housing help, and social services. But you can also prescribe green activities. For example, outdoor or nature-related activities. You can prescribe nature walks, eco or forest therapy, gardening, urban walks, and of course, sports. You can also prescribe blue activities, anything related with water, such as river, lakes, waterfall, beaches. So whether you want to go up, go near, or even go under the water, so swimming, kayaking, boating, diving, etc. You can also prescribe arts and culture by joining craft classes, visiting galleries, attending music session, singing in choir, and even visit museum and historical landmarks. Or you might prescribe to the patients cooking classes, community kitchens, and even volunteering. So as you can see, social prescribing are not just limited to older adults. So this is the beauty of social prescribing. They can also benefit children, teenagers, families, and anyone who is struggling with long-term health issue. For example, in patients with diabetes, cancers, mental health challenges, and also those who are in social isolation as well. Because social prescribing has been shown to help with mental and physical health. In many reviews across various countries, it has been shown to reduce loneliness and improve well-being. It has also has positive physical effects such as better sleeping pattern, improved diet, and increased physical activity. So effectiveness is not just limited to certain ages, but extend from children and young people to older adults as well. Now, let's talk about the healthcare system impact. So, I want to imagine this number. What would this mean in your workplace or perhaps in your environment as well? So, social prescribing has been shown to reduce GP visits by 24%. So, my fellow colleague will be happy with this. Emergency visits also reduced by about 24%. Hospital admission also reduced by about 21%. And remember, about 1 in 5 of the GP consultations is related to a problem that is actually primarily a social problem. So from an economic perspective, the return are just as impressive. In Canada, for example, every $1 invested generates a social return of around $4.43. In the UK, the figures ranges about £2 to more than £8 for every pound invested. That amounts to about 300 millions of dollars saved in reduction of hospitalization, ambulance call, and also emergency visits. Of course, nothing is perfect. The evidence can be variable in terms of quality, variability, the long-term impact, etc. So there are also challenges, of course, with funding, resources, and also awareness. So perhaps integrating social prescribing into a already stressed system also take a lot of effort. And there's always a risk of unintentionally leaving out the most vulnerable groups, such as those with children and also young people. But here's the key point. Many countries, from high income to low income to middle income country, are still moving forward with social prescribing anyway, because they see the value. So several countries has actually established institutes or academies of social prescribing to explore this further. So our beloved neighbor, Singapore, has also been seriously developing social prescribing programs for over the last 5 years. How about in Malaysia? Here in Malaysia, social prescribing is not yet formalized, but we can see the seeds here and there. We have health practitioner partnering with NGO, religious bodies, and community groups. We also have older adult programs to reduce isolation, exercise sessions that was linked to mosques, temple, churches, and community halls. However, the problem is these efforts are very patchy. So there are also concern about privacy, cultural sensitivity, and of course, there is no formal link worker rules, means that the system itself is not cohesive. But the potential is enormous because we are still in the early stages. But we do need to remind ourselves to adapt it to our culture and our context. So here is my call for you to action. Let's move away from illnesses to wellness, from care to connection. So perhaps today you can start identifying one patient who could benefit from social prescribing. You can make one referral, build one relationship with your community partner. You don't have to change the entire system today, but you can change one person's life today. And maybe I personally can prescribe something for you right now. So this is what I call a walk with your dog. So Walk with the Dog is a program where doctors walk alongside patients on a Saturday morning or Sunday morning, chatting, laughing, and getting active together. So it started in 2005, where a cardiologist in Ohio, Dr. David Subbier, invited his patient to join for the walk in the park. So initially, he didn't know if anyone would show up, but eventually they did, and many come subsequently, and the program has now gone global. So we have a chapter here, actually a few chapters in Malaysia. So the Petaling Jaya chapter or PJ chapter is actually led by Prof. Fazila, which is also here with us today. So we actually meet every third Sunday at around 7:30 a.m. in Taman Jaya. As you can see, the program is joined by a diverse group of people, ranging from children to older adults, representing various ethnicity as well. More recently, we have also partnered with Malaysian Society of Hypertension and also MyWatch. And with the help of HOPE at PPUM program, we are able to screen our participants as well, especially for blood pressure. So we do invite others to collaborate with us. And if you want to utilize our platform to practice social prescribing. So this is the Facebook page for Walk with the Dog Petaling Jaya. I do implore you to follow our account for the latest information. And the latest information is that our next walk is just this Sunday on the 17th of August. So all are welcome. Do consider this as your official doctor prescriptions to join us. So lastly, remember the next time you reach for your prescription pad or prescription either online or on paper, maybe you can just pause for a while, take a second and ask yourself, what can I prescribe today that heal not just the body, but the spirit and the soul too? Thank you for joining me again today, and let's keep prescribing connection, not just care. I pass back to Dr. Christine for the next session. Thank you.
Thank you very much, Dr. Jazlan. That was really interesting and very exciting stuff. So our members of the audience, we've come to the Q&A session. We are also joined, we are very happy to have Associate Professor Dr. Fazila Hanum, who will also be joining us in the Q&A session. So let's look at the first question. Dr. Jazlan, I think you did mention this briefly, but perhaps you could go into a bit more detail here. This is from Dr. Muazmi, and he's asked how we do social prescribing. Would you suggest a written or verbal prescription for this?
Of course, I personally would like the prescribing to be in written form, because we always see patient keep forgetting our advice, for example. Okay, so what you can do is that you can write on papers or memo regarding information that you want to convey to the patient. Where do you want the patients to go to? For example, what activities that you can do, or if you want to prescribe, for example, walk with the dog to the patient, so you can tell them to follow their social media, or you can write down the date and further information regarding the activities. So in the UK, for example, they have this robust system of link workers. So there would be some mechanism of referral, official referral, whether it is in their EMR or through paper referral to the link worker. So the link worker will then connects the patients to various social prescribing activities that is available around that area. Yeah.
Yeah, agree that the evidence also suggests that when you provide a written prescription, it's a lot easier for patients to refer to, because very often in a consultation, when you're telling them lots of things, it helps them to actually retain what you've told them. So something to refer to, like if you're going to see them over the next 6 months or so, they might not be able to remember if you tell them. I mean, just tell them what it is that they need to do. Also, keeping in mind the SMART principle, with specific, measurable, achievable, and realistic, timely targets. Yeah. Prof. Fazila, do you have anything to add with respect to the written or verbal prescriptions?
Oh, yeah. I think it's a very good question. Basically, when we are in the clinic, whatever we are going to prescribe to the patient, we will just either put it through our EMR, or write it and give it to the patient. So like what Dr. Jazlan highlighted, I think writing down what they should do, and as a lifestyle medicine physician, I believe in writing out their SMART goal, in which whenever you want to prescribe anything, you should have their goal and how they're going to do it. So same goes to social prescribing. I think applying this approach might be the best solution, because you can have a shared decision making with the patient. So when patient agrees with what you have planned for them, I think that will be something that they would do. So yeah, I would say writing down is good, and explaining or showing them, of course, being a role model, showing them what you are doing outside would be something that they will appreciate, as what I believe in my practice. That's why I started Walk with the Dog, because I think I should go out and be the role model, so that the patient or the community will come and join us in the social activity.
Yeah, we've had pretty good responses here. The last few sessions we've had since we started this year. So every third Sunday of the month. Yeah.
Each Sunday.
Yeah. Okay. The next question, either one of you can take this. Yeah. This is from Prof. Tan Maupin. We would really like to work together to establish social prescribing. And what do you think about establishing a social prescribing network in Malaysia?
Thank you, Prof. Tan. I believe Prof. Tan has do a lot of research or studies regarding social prescribing as well. So several of my references that I took for this slide are actually written, or the Prof. Tan was involved with that documents as well. So of course, establishing a social prescribing network would be great in Malaysia. We know that many countries, for example, in Singapore, and of course in UK, Canada, and also even US, they already have their own network, their own academies, their own institutions to about social prescribing. So but we have to start small. Perhaps what we can do is that we can start the network in our center first before applying to other centers or even in the MOH settings. So a lot of things need to be discussed, as I mentioned just now, regarding their barriers and also limitations. Of course, the main barrier would be resource and the establishment of link worker to connect us with these social prescribing activities. Yeah. So definitely the long-term plan is that. Yeah. Thank you.
Okay, yes, we're always open to collaborations, yeah, for the betterment of our patients' quality of life.
Yeah, definitely.
Prof. Fazila, with regards to, do you have anything to add with regards to establishing a social prescribing network?
Yeah, I think what I have started is just a starting point in our PJ community. I believe connecting with the community is the best for social prescription because we empower them, and patients or the community really appreciate when we as a doctor go down and do activities with them. I know most of the time we can't do it, but we need to show some effort that you can still see us outside there, not only in the consultation clinic, but building up network like what Prof. Martin say. I think that is very great. So if anyone would like to be in the team, we can start discussing and see how we can move forward. Maybe we can focus in our community first for surrounding PPUM, and then we can expand with getting other collaborators, expand through statewide or nationwide.
Yeah. So yeah, absolutely. Yeah, important to start with these baby steps, and just hopefully it will lead to bigger strides. Yeah. So we have a comment followed by a question. So Dr. Dalila, she said, having able to work with social prescribers in the UK, yeah, the service is very crucial and makes our lives as doctors a lot easier. I would even go as far as saying as they are better than saving lives than any pill. No side effects also. Mainly good effects, I think. The only issue is the lack of resources, particularly the lack of link workers, right? So that's followed up by a question from Dr. Ian Chung. Should we empower our social workers, perhaps, to be link workers? Is that something feasible or doable?
That is feasible if you want to empower our social worker to be link worker. But I believe in the UK, for example, link worker are employed by the health services instead of the social welfare services. So link worker actually can also refer the patients to their social welfare in the UK, for example. So there's a bit of distinction between the work of link worker and also social worker. So, but in Malaysia, for example, I believe our social workers, the numbers of social worker in Malaysia also not that great. So if we were to add on, other things on top of their current job, that may be a bit difficult for them. So I believe, of course, if we have a proper link worker, it will be better because they can also link other than the social worker, social welfare part. They can also link to other social prescribing activities as well. So social prescribing is not just about the financial, the housing. It is also about connectivity. It's also about doing activity outside and connect with other people as well.
All right. Thank you for that, Dr. Jazlan. We have another question from Professor Nick Sharina. How do you approach patients who might have negative ideas about the idea? For example, they might respond to you by saying, no, I don't like people. Oh, it's very difficult to go out, and so on, in your experience.
So, Prof. Nick, this is a very interesting comment. So, me and Prof. Saja is currently doing a systematic review on social prescribing. So, we look into the types of activities that could help with patients who are with cancer, who are recovering from cancer. So, in that review, we found that there are many activities that can be done that not necessarily you need to meet up with people in a way. So, for example, things like gaming, okay, you can game, you can talk to people, you don't have to meet them, you don't have to even open your camera. Things like diary, things like writing your own poems, your own short story, for example. So there are many activities that can be considered as social prescribing. So it's just that finding that suitable activities that suits with your patient. So again, exploring and also personalizing your prescription to your patient, as we always emphasize in primary care.
Mhm. So it's also about tailoring your prescription to the individual person sitting in front of you. Not everyone may be into social activities, for example. In fact, we see this in a lot of younger people as well, and therefore many reasons. And there's a suggestion from Dr. Muazmi. Perhaps we could have a specific referral form to medical social workers with tick boxes and suggested activities such as forest bathing, hot spring dips, hugging a tree, grass grounding, and as you mentioned, writing poems and so on. Yeah.
Interesting suggestion from Dr. Muazmi.
Yeah.
We can discuss about that, Dr. Muazmi, later.
Yeah. So a lot of the evidence that you've shown and some of the activities we're doing, they're quite suitable for urban areas, especially where there are NGOs that we can collaborate with. Yeah. But how about patients who are living in more rural areas where, they might not have that many NGOs or access to sort of facilities? So how can we tailor some of the social prescribing to patients in rural areas, especially in our country?
So I've worked in a rural clinic as well.
Yeah.
So I believe in the rural clinic, usually the most important person is the ketua kampung or even the local politicians who are quite active in helping out with this. So in a rural area, so I believe nature or green prescription or blue prescription is perhaps more suitable for them. Some of the picture that I've shown actually are from my stint during my stint in the rural clinic as well. So you can go to rivers, you can go to the lakes, so you can swim, you can walk around the forest. There are many gardens around rural area, for example. So definitely there's opportunity for social prescribing as well. Yeah.
I do agree with Dr. Jazlan. Basically,
Mhm.
you don't need facilities, you just can go outside in the nature and environment to get this done. It doesn't matter whether you're in urban or rural area, basically.
Some really good suggestions we have here. First from Prof. Nick Sharina. Yep. This is important. Yeah, it helps to get the family members involved, both in hearing about the suggestions as well as in participating with patients. And from Dr. Chong Karlin, this is another opportunity for social prescribing networking. Maybe you can make use of clinic kesehatans, in which some have what we call this clinic warga emas. And some clinics have very particularly active clinic warga emas, to widen social prescription for these rural areas as well. Yeah. In fact, I think sometimes we get better participation in rural areas and from this clinic warga emas sometimes. Yeah.
Actually, like Prof. Fazila said just now, they are very eager for us to come down and visit them and do activities there with them as well. Yeah,
Yeah.
they like these activities. Yeah.
like with Walk with the Dog, I think we've had invitations to start in other chapters, other parts of the Klang Valley as well. So yeah, let's see how that goes. Hopefully this will be a good opportunity to expand that network, social prescribing network.
Yep.
Right. So there aren't any more questions here in the chat box or Q&A boxes. Yes. Okay, Prof. Khaireen, yes, you're absolutely right. I think we have been doing social prescribing without knowing that we have, been doing it. Yep.
Yeah.
It is something that we've been doing, but perhaps putting it on paper will actually help to enforce this.
Yeah.
Okay, yeah, we have one more question here from Prof. Siti Nur Kamila. Is there evidence on waiting areas which can promote social connection among patients in the clinics? Is this something that we can implement in our clinics within the hospital?
This is an
Waiting
interesting,
areas.
interesting idea from Prof. Kamila. But I guess what we can do is that perhaps we can do some activities in the clinics. We can put up some games, for example. You want to put the chess game in the clinic if it's feasible. So I need to talk with my clinic team as well if this is something to talk about. So again, social prescribing can be a lot of things. Even reading books, for example, if you want to put books in the clinics. These are some of the things that perhaps you can do in the waiting area. Yeah.
All right. Okay. Yes, the pusat activity worker must as well. Yeah. Okay. This has been a very, very good discussion, very interactive. Thank you very much, Dr. Jazlan and Prof. Fazila. Thank you, audiences, for your questions and suggestions. Would you like to leave us with any closing message, Dr. Jazlan?
So my closing message is that when treating the patient, not just treat their illness, okay, think about the biopsychosocial aspect, and one of it is social. And of course, if there's any indications or any needs for social prescribing, do consider prescribe social activities or do your social prescribing. Yeah.
Right, great stuff,
Thank
Jazlan.
you.
Prof. Fazila, would you like to have a closing message?
Yeah, I think it's the same, but basically in primary care, if possible, we do not want to add pills on the patient prescription. I think doing a lifestyle intervention like social prescribing will help. I think there's evidence to reduce a lot of non-communicable disease parameters. So I think this is the way to move forward. It's not only reducing pills, it's reducing the healthcare burden for the nation. Yeah, and come do join us this Sunday.
Yes, looking forward to catching up with all of you this Sunday.
Okay.
Right. Thank you very much, everyone, and have a great Wednesday.
Thank
Good
you.
day.
Bye-bye.
Thank you. Bye.